I got written up for having an unprofessional odor during a code. The odor was liquid stool from a patient with C. diff who'd smeared it everywhere while I was trying to save someone's life in the next room. I'm an ICU nurse, 6 years in, and that shift, 3 months ago, was the worst of my entire career. I've replayed it 1,000 times. I've had nightmares about it, and I still can't believe I got disciplined for what happened. It started normal enough. I had 2 patients that night. Room 12, elderly woman with C. diff, confused but stable. Room 14, post-surgical patient, also stable. Manageable assignment. I'd had worse. Around 2 a.m., I went to check on Mrs. Patterson in room 12. She had C. diff. Clostridioides difficile. Causes horrific liquid diarrhea. The smell is distinctive, awful, impossible to forget once you've smelled it. She'd been confused all evening, picking at her IV, trying to get out of bed. I checked her every 30 minutes, made sure she was safe. But sometime between my 1:30 check and 2 a.m., she'd pulled out her IV. Then she'd had explosive diarrhea. Then she'd spread it. I opened the door and the smell hit me like a wall. Liquid stool everywhere, on the bed, the walls, the monitors, the floor, on her. She was sitting up, hands covered, smearing it on the bed rail while looking at me with confused, frightened eyes. "I'm sorry," she kept saying. "I'm sorry, I'm sorry." My stomach turned, but I kept my face neutral. "It's okay, Mrs. Patterson. Let's get you cleaned up." I grabbed supplies, started the process. This wasn't my first C. diff explosion, but it was the worst I'd seen. The smell was overwhelming, acidic, rotten, inescapable. It got in my nose, my throat. I could taste it. I was maybe 5 minutes into cleanup, had gotten her somewhat cleaned, was working on the bed when the code alarm went off. Room 14. My other patient. My heart stopped. I looked at Mrs. Patterson, covered in stool, looked at myself, gloves covered in it, scrubs splattered, looked at the door. The code alarm kept blaring. I ran, ripped off my gloves at the door, grabbed new ones from the hall, sprinted to room 14. My patient was coding, no pulse, not breathing. The code team was arriving, people flooding in. I jumped in, started compressions, called out what I knew about the patient, medical history, medications, what had happened before the code. That's when I noticed people backing away from me. Subtle at first, then more obvious. Wrinkled noses. Someone coughed. A respiratory therapist turned her head away while working. I was covered in C. diff. The smell was on me. My scrubs, my shoes, probably my hair. I'd run straight from that room to this code. But I couldn't stop. My patient was dying. I kept doing compressions, kept calling out information, kept working. We got him back. Pulse returned, blood pressure stabilized. The code ended. Everyone started dispersing. That's when my patient, the one I just saved, said it. Weak, confused, but clear enough. "What's that smell?" Someone said, "Let's get you comfortable, sir. We'll take care of everything." But I saw his face, the disgust, the way he looked at me, the nurse who'd just done chest compressions on him like I was something dirty. I backed out of the room, stood in the hallway, realized I was shaking. The charge nurse found me. "You need to go clean up. We can smell you from the nurse's station." I had to. Mrs. Patterson had an episode, then he coded. I couldn't. "I understand, but you need to change. We'll cover your patients." I went to the locker room, tried to change, but the smell had soaked through to my skin. I scrubbed my arms, my neck, anywhere exposed, put on fresh scrubs, went back to Mrs. Patterson's room. Spent the next 4 hours cleaning. The walls, the floor, the monitors, the bed, everything. Other nurses helped initially, but I did most of it. That's the reality of nursing. Your patient, your mess.
I finished my shift at 7 a.m., went home. My husband took one look at me and said, "You need to shower." Now. I showered for 45 minutes, scrubbed until my skin was raw, could still smell it. Changed the water temperature, used different soap, scrubbed again. Finally got out. Threw my scrubs directly in the trash. Couldn't imagine washing them, wearing them again, having that smell associated with those clothes. Sat on the bathroom floor, wrapped in a towel, and cried. From exhaustion, from stress, from the horror of that shift. My husband knocked on the door. "Are you okay?" "No," I said, "but I will be." I slept for 12 hours, woke up and could still smell it. Phantom smell. My brain convinced it was still there. Showered again. 3 days later, I got called into my manager's office. "We need to discuss a complaint," she said. My stomach dropped. "What complaint?" "The patient in room 14, from the code on Tuesday night. He filed a complaint about an unprofessional odor during his care, about his nurse smelling of feces during a medical emergency." I stared at her. "You're joking." "I'm not. He was quite upset, said it was disgusting and unprofessional." I was covered in C. diff because my other patient had an explosive episode. I was in the middle of cleaning it up when he coded. I ran directly from one room to the other to save his life. "I understand the circumstances." "Do you?" I interrupted, because it sounds like I'm being complained about for prioritizing saving someone's life over changing my scrubs. "You should have taken a moment to clean up." "He was coding. He had no pulse. You want me to have stopped to change clothes while my patient was dying?" She looked uncomfortable. Obviously, in a code situation, immediate response is priority, but there were complaints about the odor, and we have to address all patient complaints. "So what happens now?" "I'm issuing a written warning, documentation of the incident. It'll go on your file." I felt numb. A written warning for saving someone's life while not smelling good, for failing to maintain professional appearance standards during patient care. During a code? Yes. I stood up. "Is there anything else?" "I know this is difficult. Is there anything else?" She sighed. "No, that's all." I left her office, went to the break room, sat down and stared at nothing. Another nurse found me. "You okay? You look like you've seen a ghost." I got written up. "For what?" "For smelling bad during the code last week." She stared at me. "You're kidding." I wish I was. She sat down next to me. "That's insane. You saved that guy's life." "Yeah, while smelling like C. diff. Apparently that's unprofessional." "What were you supposed to do? Let him die while you showered?" "According to the complaint, yes. Apparently, yes." Word spread through the unit. Some nurses were sympathetic, others were careful, like my situation was contagious, like if they acknowledged how unfair it was, it might happen to them. The patient recovered fully, was discharged a week later, never thanked me for the code, just complained about the smell. I still work that unit, still take care of C. diff patients, still respond to codes, but everything changed that night. Now I'm paranoid. If I have a messy patient and something happens elsewhere, I panic. Do I take 30 seconds to change? Do I respond immediately? What if those 30 seconds matter? What if someone complains about me again? I have nightmares about it. The smell, the cold, the complaint, all mixed together. I wake up checking if I smell like stool. My husband says I'm different since then, more anxious, more defensive. Last week, I had another C. diff patient. During care, I heard a code alarm in another pod. I froze. Actually froze. Couldn't move. Another nurse ran past me to respond. Later, she asked why I hadn't helped. I couldn't explain. Couldn't say that I was terrified of having to choose between being clean and being fast. The written warning is still in my file. Permanent record. Failed to maintain professional appearance during patient care. Not responded immediately to code. Not saved patient's life. Not managed multiple critical situations simultaneously. Just unprofessional odor. I think about that night constantly.
about Mrs. Patterson confused and covered in her own stool, about my patient coding, about the choice that wasn't really a choice. I did the right thing. I ran to save a life. I did compressions covered in C. diff because every second mattered. And I got punished for it. That's what haunts me. Not the smell, not the mess, not even the exhaustion of cleaning for 4 hours. The fact that I did everything right, and it still wasn't enough. The system wanted me to save lives and smell good doing it. When I couldn't do both, I chose lives. And somehow, I'm the one with a warning in my file.
They moved into the ICU, literally moved in, brought cots, a cooler, changes of clothes, stayed 24/7 for 3 weeks while their father died. And they made those 3 weeks a living hell for everyone on the unit. I'm an ICU nurse, 7 years in, and I've dealt with difficult families before. But this family, the Hendersons, they were something else entirely. They didn't just visit, they occupied, they demanded, they accused, they filmed everything. And when it was over, when their father died exactly as we'd told them he would, they tried to destroy my career with a lawsuit that took 2 years of my life. Mr. Henderson came to us from a smaller hospital, 72 years old, end-stage heart failure, kidney failure, respiratory failure, multi-organ system failure. We were his last stop before hospice, though his family refused to accept that reality. The family arrived with him, wife, 3 adult children, 2 daughters-in-law. 6 people who immediately made it clear they would be staying. "We're not leaving him," the oldest son said. "We'll be here around the clock." I tried to explain visiting hour policies gently. "I understand you want to be here, but we do have limits on overnight visitors. We're not visitors, we're family. We're staying." I looked to my charge nurse. She looked to the manager. The manager, after a whispered conversation with administration about patient satisfaction and family-centered care, told us to allow it. So they stayed, all 6 of them, in a single ICU room. They brought in camping cots, set them up around the room, brought a cooler with food and drinks, created a camp in the ICU. Other patients' families saw it and asked why they couldn't stay too. We had no good answer except administration approved it for them. It started small. Questions about every medication, every intervention, every vital sign change. I'd answer patiently, explain what we were doing and why. But it escalated. They started demanding approval rights. "Before you give him anything, you need to tell us what it is and get our permission." "I understand you want to be informed, but in acute situations we need to act quickly. Nothing goes into our father without our approval, nothing." I documented their demands, told my manager. She told me to work with them and keep them informed. Week 1, they started filming. Phones out constantly, recording everything. Me doing assessments, me giving medications, me charting, conversations with doctors. "You can't film in here," I said. "It's a violation of other patients' privacy, and we're documenting his care in case we need it later." Need it for what? In case something goes wrong, in case we need to prove negligence. My stomach dropped. They were already building a case, already assuming we'd hurt him, already treating us like the enemy. I reported it. Administration said we couldn't stop them from filming their own family members' care unless it interfered with other patients. So they kept filming. Week 2, they started questioning everything aggressively, not just asking, interrogating. "Why is his oxygen saturation lower than yesterday? His lungs are filling with fluid from his heart failure. We're managing it with, you're not managing it well enough. What else can you do? We're doing everything possible. His heart can't pump effectively anymore, so you're giving up on him?" "No, we're providing maximum support, but his organs are failing. We've explained the prognosis. We don't accept that prognosis. Do more." These conversations happened multiple times per shift with every family member. They'd tag team me. One would question my medications, another would demand different treatments, another would accuse me of not caring enough. I started dreading my shifts, started hoping I wouldn't be assigned to his room. When I was, my anxiety would spike the moment I walked in. Week 2, day 4. The son followed me to the parking lot after my shift. I was walking to my car, exhausted, when I heard him call my name. I turned. He was 10 feet behind me, phone out, filming. "I need to talk to you about my father's care." "I'm off shift. You can speak with the oncoming nurse," or "You've been making mistakes. I've documented them. I have proof." My heart was pounding. "If you have concerns, please discuss them with my manager through proper channels. I'm discussing them with you right now. I'm not on duty. This is inappropriate. Please don't follow me to my car. I'll go wherever I want. You work for us. My father is paying for this hospital, which means you work for him, which means you... Sir, I need you to step back." My hand was on my phone, ready to call security. He kept filming, kept talking, followed me to my car, only left when I got in, locked the doors, and told him I was calling security. I sat in my car, shaking, called my charge nurse. She said she'd report it, that he shouldn't have followed me, that security would be notified. Nothing happened. He was still there every shift, still filming, still questioning everything.
Week 3, the complaints started. 15 separate formal complaints filed with patient relations, all from the family, all about me specifically. Nurse was rude. Nurse didn't respond quickly enough. Nurse gave medications without explaining. Nurse refused to answer questions. Nurse provided inadequate care. None of it was true. All of it had to be investigated. I had to write statements for each complaint, had to sit through meetings with management, had to defend myself over and over. My manager said, "I know this family is difficult, but we need to maintain professional standards." I am maintaining professional standards. They're making false accusations. Patient relations has to investigate every complaint. Just be patient. But I was drowning, working my shifts while being filmed, questioned, accused, then spending my off time writing statements defending myself. My husband said, "You need to request not to take that assignment." I can't. We're short-staffed. If I refuse assignments, I look like I'm not a team player. They're destroying you. He was right. I wasn't sleeping, wasn't eating well, had constant anxiety, dreaded every shift. Week 3, day 5, Mr. Henderson died. Expected. His organs had shut down. We'd told the family for 3 weeks this was coming. They'd refused comfort care, insisted on full support until the end. He died with all 6 family members present, died with machines keeping him alive until his heart finally gave out despite them, and they blamed us. Within hours, they were demanding an autopsy, claiming negligence, saying we'd let him die, saying if we'd done more, he'd still be alive. The accusations became a lawsuit. Medical malpractice, wrongful death, naming the hospital, the doctors, and me personally. Me, by name, the nurse who'd cared for him, who'd answered their endless questions, who tolerated their filming and accusations and harassment. The lawsuit took 2 years. 2 years of depositions, of reviewing my own documentation, of reliving those 3 weeks over and over. My lawyer said the case was baseless, that we'd provided appropriate care, that the family's behavior was documented, that their unrealistic expectations were clear. But it didn't matter. My name was on a lawsuit for 2 years. Every shift, I knew I was being sued. Every patient interaction, I worried it would happen again. I developed anxiety, real, clinical anxiety, started having panic attacks before shifts, couldn't sleep the night before work, would replay interactions in my head obsessively, wondering if I'd said something wrong, done something that could be used against me. The case was eventually dismissed. The judge found no evidence of negligence, found that we'd provided appropriate care, found that the family's expectations were unrealistic given the patient's condition. But dismissal isn't vindication. My name was on that lawsuit for 2 years, the stress had been real, the anxiety remained. I transferred to a different unit. Couldn't work ICU anymore. Too many memories of that family, that room, those 3 weeks of hell. I'm in therapy now, working on the anxiety, the hypervigilance, the fear that every difficult family will turn into another lawsuit. My therapist asked, "What would you have done differently?" "Nothing," I said. "I provided good care. I was professional. I did everything right." "Then why do you feel responsible?" "Because they made me feel responsible. For 3 weeks, they told me I wasn't doing enough, wasn't caring enough, wasn't good enough. And even though I know logically that's not true, part of me still believes it." That's what they did. They didn't just harass me, accuse me, sue me. They made me doubt myself, made me question whether I was a good nurse, made me afraid of doing my job. I see families setting up camp in patients' rooms now, and I feel sick. I see phones filming, and I want to leave. I hear aggressive questioning, and I shut down. One family, 3 weeks, 2 years of legal hell, and I'll never be the same nurse I was before them.
I vomited in a trash can during patient care, in front of the patient, in front of family, in front of my colleagues. Just turned to the side and vomited because of what I'd found under that dressing. Hundreds of maggots, live, moving, crawling out of a wound that hadn't been properly assessed in weeks. A wound on a patient who'd been lying in a nursing home, suffering, while staff documented wound care performed without ever actually looking at it. I'm an ICU nurse, 8 years in, and that discovery 3 months ago destroyed something in me. I can't do wound care the same way anymore. I can't trust documentation from nursing homes. And I have nightmares about movement under skin that shouldn't be moving. The patient came from Shady Oaks Nursing Facility. I'm using a fake name, but trust me, the real one should be burned into public record. Transferred to us for failure to thrive and wound management. The report I got was minimal. Sacral wound, being treated, needs higher level of care. Nothing alarming. Nursing home wounds are common. We see them all the time. Mrs. Davis was 76, diabetic, immobile from a stroke 2 years prior. Nonverbal but aware. She could squeeze your hand, make eye contact, show discomfort. She was in there, trapped in a body that didn't work, but present. When she arrived, she was moaning, not screaming, just this low, constant moan of pain. The kind that tells you someone's been hurting for so long, they don't have the energy to scream anymore. The smell hit me when they wheeled her in. Not just the normal body odor of someone who hasn't been bathed properly, something else. Something wrong. Sweet and rotten at the same time. "What's that smell?" I asked the transport team. They shrugged. "She came like this. Nursing home said she has a wound." I got her settled, started my assessment. Vitals were terrible. Fever, elevated heart rate, low blood pressure. She was septic, clearly infected. "Let's look at this wound," I said to my charge nurse who was helping me with the admission. The documentation from the nursing home said, Stage 3 sacral ulcer, wound care per protocol, showing signs of healing. Showing signs of healing, that's what they'd written 2 days ago. We positioned her on her side. The dressing was old, should have been changed that morning per their documentation, but clearly hadn't been. It was saturated, stuck to the wound, crusted at the edges. I started removing it gently. It was adhered. I had to soak it with saline, work slowly to avoid causing more damage. Mrs. Davis was moaning louder, squeezing the bed rail. I kept talking to her softly. "I know, honey. I'm sorry. I'm trying to be gentle. Almost done." The dressing finally pulled away, and that's when I saw them. Movement. White, writhing movement in the wound bed. My brain took a second to process what I was seeing. Then it clicked. Maggots. Hundreds of them, maybe thousands. White larvae, squirming, crawling out of a wound that hadn't been properly assessed in weeks. I made a sound, not a word, just a sound of horror. My charge nurse looked, said, "Oh my God," and stepped back. I turned to the trash can and vomited. Couldn't stop it, couldn't maintain professional composure, just vomited while Mrs. Davis moaned and maggots crawled out of her body. I wiped my mouth, turned back, had to finish the assessment, had to help her. The wound was massive, maybe 15 centimeters across, deep. I could see bone. The tissue was black, necrotic, rotting, and full of maggots feeding on the dead flesh. Some were falling out onto the bed, crawling, looking for more dead tissue to consume. Mrs. Davis was watching me, making eye contact. She knew. She'd been feeling this for God knows how long, feeling insects eating her flesh, unable to speak, unable to advocate for herself, unable to do anything except lie there and endure it. I started crying, standing there in my gloves, looking at this horror, and I started crying. "I'm so sorry," I told her. "I'm so sorry this happened to you. We're going to help you, I promise." My charge nurse called the doctor, called the supervisor, called state inspectors, called everyone who needed to know that a nursing home had sent us a patient who'd been left to rot. The doctor came in, looked at the wound, and said words I'll never forget. "This didn't happen overnight. This is weeks of neglect." We had to clean the wound, had to remove the maggots, manually, with tweezers, one by one, had to debride the necrotic tissue. It took hours. Mrs. Davis had to be sedated for it. We gave her everything we could for pain, but the damage was so extensive that even touching the area caused agony. We collected the maggots, had to, for documentation, for evidence, filled a specimen container with them. I had to watch them squirm in that container while I documented everything. The smell during cleaning was unbearable. Rotting flesh, infection, decay. Everyone in the room was gagging. We had to take breaks, step out, breathe clean air, then go back in. We found out later that the wound had been dressed for weeks without anyone actually looking at it. The nursing home staff had documented wound care performed daily, but they just put new dressing over old dressing, never looked underneath, never assessed. Mrs. Davis had been lying in her own filth with maggots eating her flesh, and the documentation said she was healing. The state inspection found multiple violations. The nursing home was cited, fined, they promised corrective action. They stayed open. They're still operating. Mrs. Davis stayed with us for 6 weeks. The wound required multiple surgical debridements. She developed septic shock. We nearly lost her twice. But she survived. Eventually transferred to a different nursing facility, one we'd vetted carefully. Last I heard, she was alive. The wound was healing. Slowly, but healing.
I finished that shift on autopilot. Went home, showered for an hour. Couldn't get the image out of my head. Couldn't stop feeling phantom movement on my skin. That night, I kept waking up feeling like things were crawling on me. Would turn on the lights, check the bed, find nothing. But I could swear I felt something moving. It's been 3 months. I still have that reaction, especially at night. I'll be lying in bed and suddenly feel convinced there's something crawling on my skin. I know it's not real. I check anyway. I can't do wound care without checking obsessively now. Every dressing removal, I'm looking for movement, looking for any sign of infestation. My colleagues think I'm paranoid. Maybe I am, but I saw what happens when people don't look. when they trust documentation instead of assessing, when they assume wounds are being properly cared for. I refuse to accept patients from Shady Oaks now. Flat out refuse. My manager said I can't refuse assignments based on facility. I told her I'd quit first. She backed down. 3 other nurses have the same policy. We won't take their patients. We don't trust them. We can't. Last month, we got another patient from them. Different nurse took the assignment. Wound documentation said healing well, minimal drainage. That nurse found early necrosis, not maggots. She caught it before it got that far. But the wound was infected, improperly dressed, clearly not being cared for properly. She called me in. "You were right," she said. "They're not looking at these wounds." More reports filed, more violations, more fines, facility still open, still accepting patients, still providing inadequate care. I had nightmares last night. Same as always. I'm removing a dressing and finding movement underneath. But in the dream, the maggots aren't just in the wound. They're spreading, crawling up my arms. I can't get them off. I wake up checking my skin, knowing it's irrational, unable to stop. My therapist says it's trauma, that I witnessed severe suffering and my brain is processing it through intrusive thoughts and hypervigilance. She's probably right, but knowing it's trauma doesn't make the nightmares stop, doesn't make me stop seeing those maggots every time I close my eyes, doesn't make me stop feeling that phantom crawling sensation. Mrs. Davis trusted that nursing home to care for her. She couldn't advocate for herself, couldn't check her own wound, couldn't demand better care. She lay there for weeks with insects eating her flesh, in pain, alone, helpless. That's what haunts me most. Not the maggots themselves, the suffering, the betrayal. The fact that people documented care provided while she rotted. I'm still a nurse, still work ICU, but I'm different now. More suspicious, less trusting. I check everything myself, question everything, look under every dressing, even when documentation says it's fine. Because I learned that documentation lies, that people sign off on care they never provided, that patients suffer while paperwork says they're healing. And I learned that some images never leave you. Some smells never fade. Some moments change you forever. I vomited in that trash can 3 months ago, lost my composure, failed to maintain professional detachment. But Mrs. Davis got the care she needed, got the attention her wound required, survived. And that nursing home got reported, investigated, cited. Not enough consequences. They should have been shut down, but at least there was something. I just wish I could stop feeling things crawling on my skin in the dark. I wish I could forget the way those maggots moved. I wish I could unsee it. But I can't. And I never will.